Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the bright side of the health. I am your host physiotherapist Meghna Dave, and today we are going to talk about recommended exercises for cancer survivors. Now, this is not a new thing. Every one of us knows the importance of physical activity in maintaining our health and well-being. And so does applies for cancer survivors as well. The only thing that changes or matters here is the intensity of exercises. Unlike an individual who is not a cancer survivor has to be watchful about the intensity of the exercises because that matters. You can't go very aggressive with your exercise, nor you can be completely sedentary. In both the scenarios, you are going to harm your health. So in this video, what I'm going to do is I'm going to just shed a light on a general recommended exercises by American Society of Cancer for different types of cancer survivors. I will be also talking about some examples of physical activity that are safe and that you can do during different stages of cancer, and some ideas with which you can stay physically active while staying at your home. So if you who are a cancer survivor want to know more about intensity of physical activity or what is the role of physical activity in your well-being, make sure to watch this video till the end. Let's begin. So friends, as I said, cancer recovery as well as cancer surviving is a major thing. Your body is not the same and your body requires additional and extra care. And when it comes to a self-care practice, the most important self-care practice that you have to do is to stay physically active. When I say physically active, doesn't mean workout. It's important to do moderate level or moderate intensity of physical activity or exercises that will make sure that there is more dopamine release in the body. It makes sure that the blood circulation is well, your all the vitals are running normally. And that's what is important for any individual who is recovering or else surviving out of cancer. Now, according to American Society of Cancer, there are some recommendation of physical activity that needs to be done for different types of cancer survivors. Let's have a look at that. So let's first talk about the breast cancer survivors. Ideally, a cancer survivor who has undergone a breast surgery or else radiation or chemotherapy is recommended to do around 150 minutes of physical activity of moderate level. Doing a very intense or stressful or hit-based exercise program can damage. However, you can progress toward it in the later stages just after taking consent from your doctor and also doing under supervision. Similarly, for a cancer survivor who has undergone colorectal treatment, they also need to undergo 115 minutes of moderate level of physical activity. The physical activity which are moderate level should also be done under guidance initially and then gradually progress towards more intense or else at more frequency. For cancer survivors who have got prostate cancer, needs to be more cautious when it comes to doing exercises as they might experience some general health related issues and health related challenges, and in those scenarios doing a 150 minutes of physical activity is safe but at the same time requires multiple pauses and lot of supervision initially. Coming to the lung cancer survivor also needs to do 150 minutes of physical activity on an average of moderate intensity where the focus could be more towards neck and shoulder region and around the spine region. At the same time, doing more of CVS or cardiovascular exercise are helpful. Having said that, you can do these exercises in different formats, like simple example would be a brisk walk, a cycling, swimming, etc., which is fairly safe and will have less risk of injury over your body. Having said that, the frequency can depend on your overall health and well-being, but in general, once in a day, 3 to 4 times in a week is a good practice to go ahead with. As I said, these are some general guidelines, but this guidelines or the ideal exercise time can vary individual to individual, and that's why a role of a physiotherapist comes into a picture. So in our team of HealthQ Rehab, we have got a cancer rehab expert, Dr. Deepal Shah, who is going to connect with you and work with you no matter at what stage of cancer you are at and help you identify certain physical activities that you can do at your home, at your pace, so that your overall well-being quotient is maintained and you can take care of yourself in a very nice manner. I hope this video gave you a good motivation, a good sense of idea as in how to stay physically active and well during your journey of cancer survivorship. For more such videos, make sure to follow us and reach out to us if you need help. On that note, I'll end this video here and see you in another video. Thank you.